Madam Speaker, I deliver the ministerial report on the whole of government response to the findings of the territory coroner inquests into the deaths of Miss Yunupiŋu, 𝙍𝙬𝙬𝙎𝙏, Rubuntja, and 𝙍𝙀𝙬𝙬𝙍𝙎 Haywood 2024, NTLC 14, notified on July 28, 2025. I am pleased to speak to the 𝙍𝙀𝙬𝙬𝙎𝙏 government's response to that report handed down into the tragic domestic violence-fueled deaths of those 4 Aboriginal women. The lengthy report, published 17 months after the coronial inquiry commenced and some 6 months after the last hearing was held, contained 35 recommendations. It is not comfortable reading, nor should it be. It not only details the circumstances in which the 4 women who were the subject of the coronial died, but also provides a summary of the horrific deaths of 68 other mainly Aboriginal women murdered by men who were supposed to love and care for them over the preceding 25 years. The retelling of how each of those women were lost by their families is confronting, and a stark reminder that Northern Territory Aboriginal women are disproportionately impacted by domestic, family, and sexual violence. Approximately 89% of domestic, family, and sexual violence victims are Aboriginal women. Aboriginal women are 35 to 40 times more likely to be hospitalized because of family violence and, most tragically, 8 times more likely to lose their lives to domestic, family, and sexual violence. It is also a sad reminder that domestic, family, and sexual violence has plagued the Northern Territory for far too long. It has destroyed lives, eroded communities, changed how people deal with challenges in their relationships, and created generations of children who believe that violence in a relationship is normal, when it most definitely is not. It was then, with some hope, and the agreement of my parliamentary colleagues, as the Minister for Prevention of Domestic Violence, I tasked the Department of Children and Families to coordinate a whole-of-government response to the report and determine how the coroner's 35 recommendations differed from what had come before, and so may provide the imprimatur to take a new approach, guidance on how to approach the challenge differently, to find a new path that would finally see a shift in the outcomes for our community. To that end, careful consideration was given to all 35 of Coroner Armitage's recommendations. Extensive consultation was undertaken across all areas of government, as well as with key stakeholders on the recommendations and the report from which they were derived, examined and dissected, in search of solutions not previously explored. In anticipation of that consultation, and in recognition that a longitudinal approach would be needed if ever the dial were to shift, the 𝙍𝙀𝙬𝙬𝙎𝙏 government announced an unprecedented long-term commitment of $36 million dedicated domestic, family and sexual violence funding per year ongoing, demonstrating our commitment to addressing domestic, family and sexual violence today and into the future. I did not have a preconceived idea of the outcome of the cross-to-government consultation, but I must confess I had hoped, given the time it had taken from the commencement of the inquiry to the publication of the report, there would be a recognition that more of the same was simply not an option. I did not expect the recommendations would be a panacea to the scourge that is domestic, family and sexual violence, especially having reviewed the recommendations myself. I found them somewhat underwhelming. Neither did I expect, as some would have us believe, the recommendations would articulate a recipe that if scrupulously followed would resolve the domestic, family and sexual violence crisis faced by our community. Nonetheless, I remained hopeful that through the consultation process, something would be found that I had missed. I did not anticipate that following the extensive consultation process it would be identified that 24 of the 35 recommendations made in the report related to programs, or processes that were already in place, some for a long period of time, others for lesser periods, and still others having been completed and transformed into a new iteration. For example, Recommendation 1 of the 35 recommendations proposed a permanent domestic, family and sexual violence (ICRO) interagency coordination and reform office that would lead consistent and evidence-based domestic, family and sexual violence policy and practice across government agencies. I appreciate that the coroner is a busy person and may have missed this, but the Domestic, Family and Sexual Violence Reduction Division, which has whole of government responsibility for domestic, family and sexual violence policy, monitoring and evaluations in key programs, essentially taking on the work that was commenced by the Domestic, Family and Sexual Violence ICRO, was established in October 2023. Recommendation 2. Proposed the establishment of a peak body. In 2021-22, the Department of Children and Families entered into a 5-year agreement with the Northern Territory Council of Social Services for a Domestic Family and Sexual Violence Officer to enable sector coordination, advocacy and support for domestic, family and domestic violence services across the Northern Territory. This agreement runs until 2026-27. In addition, the Domestic, Family and Sexual Violence Training and Resource Center provides support to the sector. Recommendation 3. In relation to workforce planning, similarly articulated work that is already being done under the NT Domestic, Family and Sexual Violence Workforce and Sector Development Plan. Recommendation 4 is covered by community alcohol management plans which are facilitated under the Community-Led Alcohol Harm Reduction Federal Funding Agreement, with the Australian Government providing an additional $14.2 million over 2 years. Recommendation 5, 6, 7, 8, 10, 11, 12, 13, 14, 16, 17, 19, 23, 24, 27, 28, 29, 30, 33, and 34 similarly refer to programs and services already in place. Overall, 22 of the recommendations were supported by the 𝙍𝙀𝙇𝙀𝙑𝘼𝙔𝙍𝙐 CLP government, 10 were accepted in principle and 3 were not being supported, those being 1, as it is now redundant, and 32 and 35 as they are already accommodated in existing processes. Of the 22 supported, 4 did not relate to existing programs and so have been progressed. The best example of the 4 new programs resulting from recommendations not relating to existing programs or services was the introduction of the Circuit Breaker program, which addressed Recommendation 15. As I have now reported to this Assembly on several occasions, Circuit Breaker is designed to break the cycle of violence through early intervention, reaching young people at risk of entering the youth justice system, working with them and their families. As of this week, 225 young people have engaged with the program, with 94 of those contacts resulting in direct referral to domestic violence, health and education services to provide intensive family assistance for the young person and their family. In conjunction with this, the Domestic, Family and Sexual Violence Co-Responder Program, which was a time-limited pilot program, has been morphed into the new Domestic, Family and Sexual Violence Early Intervention and CO Responder Service. Tackling domestic violence requires close collaboration with our service delivery partners. This model ensures domestic, family and sexual violence specialists work alongside the Northern Territory Police Force and child protection staff to follow up with victim survivors and those people who use violence, ensuring risk is assessed and services are activated as quickly as possible. This follow-up is crucial to breaking the cycle of domestic violence. Trialed in Alice Springs, the program is now being expanded to Darwin, Catherine, Tennant Creek and Nulunbye. The commitment to this program is evidence of our 𝙍𝙀𝙇𝙀𝙑 CLP government's commitment to ensure programs that work and deliver results are maintained. Sadly, overall, the recommendations made were uninspiring, with only a small proportion of the recommendations made leading to the implementation of a new and innovative approach, or the continuation of what had initially been a trial program. In considering how such a long-anticipated report failed so dismally to hit the mark, a look to the approach of the previous coroner Greg Kavanagh when investigating the loss of other women in similar circumstances to see whether this was simply the way things are done in the realm of coronial inquiries, long processes, lengthy reports, and an extensive list of recommendations, I found that Mr. Kavanagh's investigations were undertaken in a timely manner. His reports were concise, and his recommendations were short, sharp, and clearly defined. This is compared with Coroner Armitage's approach, which has been protracted, resulting in lengthy reports delivered in a manner seeming to lack the humility one might expect from an officer of the court, and more focused on the reveal rather than the result. Most notable was in comparing the coronial approaches on this occasion. The process undertaken, protracted as it was an opportunity to provide a framework for true reformation in this space, but, for reasons that were unclear, Coroner Armitage chose not to do so. Throughout the report, Coroner Armitage references the impact of the cultural pressure placed on the 4 women who were the subject of this coronial. In paragraph 385, reference is made to how one of the 4 women was pressured by the matriarch of the family, of the man who ultimately killed her, to stay in the relationship and the community, because she was culturally connected to him through her child. Possibly the most confronting statement in the report appears at paragraph 384, where the coroner records, "I heard extensive evidence about the enormous pressure placed upon Miss Yunupiŋu by members of Mr. Marika's family in relation to staying in or returning to the relationship, as well as about not speaking to police or giving evidence at court about his violence. I heard evidence that Mr. Marika's family were known to, physically, return her to the relationship when she left the area to escape it. When looking to break the cycle of domestic, family and sexual violence, much is said about coercive control and the many forms it takes, but rarely is culture mentioned as being a tool in the coercive control arsenal." Coroner Armitage was astute enough to observe in paragraph 375 of the report that for an Aboriginal woman, using culture to pressure her to stay in the relationship is a form of coercive control. However, she was not brave enough to call out the behavior in her recommendations, which could have paved the way to empower communities to take a stand on this very sensitive and challenging issue. Similarly, there were many references in the report that noted in order for change to occur, Aboriginal communities must look within and be empowered to work to address the issue of domestic violence, with one witness stating on page 105 of the report, "I think that's part of the reason why communities are so disengaged at the moment and why there's some turmoil in the community is because the elders have been disempowered." Going back to the introduction of the report, where the 68 women lost to domestic violence in the preceding 25 years were remembered, the coroner noted that for many of these crimes there were witnesses to the crime who more often than not did nothing to stop the deadly assaults. In spite of all of this, the noting of the importance of local people being actively involved in shaping local solutions to prevent violence and to respond assertively when it occurs, not one recommendation was made as to how this might be facilitated. Territorians have had enough. Domestic, family and sexual violence is unacceptable in any form in any community or culture. Territorians deserve to feel safe, and those impacted by domestic, family and sexual violence must have access to the right support at the right time. Rebuilding the economy, reducing crime and restoring our lifestyle is being built upon an integrated system that addresses the root causes of violence and keeps families safe. The 𝙍𝙀𝙇𝙀𝙑 government is building a system that is stronger, more accountable and more compassionate. We owe that to the memory of Miss Yunupiŋu, 𝙍𝙀𝙇𝙀𝙑 Ragurrk, Kuman Rubuntja and 𝙍𝙀𝙇𝙀𝙑 Haywood. We owe it to all Territorians. We are taking an evidence-based, outcome-focused approach that facilitates sustainable integrated services, early intervention, community collaboration, and most critically, accountability for perpetrators. We are working closely with the Australian Government to ensure that funding and policy align with the unique needs of our Territory communities. Ending domestic, family and sexual violence is not the work of government alone, however. It requires all of us, families, friends, neighbours and community leaders, to speak out, support survivors and challenge harmful behaviours. Similarly, the Northern Territory is not alone in facing this crisis. Across Australia and the world, governments are grappling with how to end gender-based violence. We are proud to be leading with innovative, community-led solutions. We are committed to a new and comprehensive roadmap that the department has developed. This will commence once consultation has been finalised with key stakeholders. Through authentic collaboration, we can ensure that funding decisions are strategically aligned with the needs of both the community and the sector, thereby contributing to a safe and more resilient Territory. Our vision is clear: a Northern Territory where communities are safe, respected, and free from violence. That is the future we are building together. We must heed the words of the Territory's previous coroner, Greg Kavanagh, who, in his findings into the domestic violence-related death of Jodi Pulamapina in 2006, observed, "Finally, there is much to appreciate and respect in the way Aboriginal people live their lives in remote communities in the Northern Territory. However, the present-day gross violence perpetrated on some women in such communities by some men must be recognised, and something done about it. That 2 decades have passed since this observation was made with little if any change is unacceptable. Those in a position to take action to influence change must do so. There is no more time for rhetoric, a stand must be taken. As the Minister for the Prevention of Domestic Violence, I am willing to take a stand. I am willing to look at how we have been addressing domestic, family and sexual violence, and make the changes required to make a difference, to work with our community to understand how we have arrived at this dreadful circumstance, to take measured, well-considered steps to reverse this vicious and destructive cycle of violence, to hold those who perpetrate violence in their relationships to account, and, most importantly, to work with communities to address the root causes and equip them to take decisive action to address those